Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're examining the hidden gluten in soy that lurk in many over-the-counter and prescription drugs, an issue with real consequences for sensitive patients.
I'm Alara Sky. Even when we avoid problematic foods, medications can quietly reintroduce those same allergens. Recent research shows just how common gluten and soy-derived inactive ingredients are, and why transparency in drug labeling matters.
Let's start with the basics. People expect the active compound in a pill to do the healing, but few realize binders, fillers, and emulsifiers are frequently sourced from wheat or soy. What makes these substances a threat?
They trigger the same immune responses as food exposure. A starch listed on a label might be wheat-based, while lecithin could come from soy. Because manufacturers rarely specify origins, patients can't easily tell whether a product is safe.
A study published in Scientific Reports investigated this problem. Researchers reviewed 308 medications sold in Portugal, pain relievers, NSAIDs, and asthma drugs, looking for hidden gluten and soy. Why focus on these categories?
They're widely used by adults and children. Tablets, syrups, and suppositories for fever, inflammation, pain, and respiratory issues are staples in homes and hospitals. Yet allergen analyses of medicines are surprisingly rare compared with food studies.
The results were striking. Nearly half the pain relievers contained gluten. What specific percentages did the investigators uncover?
They found 44.4% of pain relief products had gluten-based excipients. In NSAIDs, gluten appeared less often, about 4.4% overall, but soy was another story, showing up in 14% of NSAID formulations.
Soy derivatives were especially common in liquids, correct?
Exactly. 30% of liquid oral pain medicines carried soy ingredients, and syrups were worst, with 60% containing soy lecithin or xanthan gum. Solid oral drugs, pills, capsules, were the primary gluten sources, at 51.2% in the pain category.
Parents often choose syrups for children, not realizing the allergen load. Were asthma inhalers any safer in this analysis?
Yes. The researchers detected no gluten or soy in the asthma and bronchodilator group. That contrast underscores how formulation choices influence exposure risk.
Another concern is whether generics differ from brand-name drugs. Did the study reveal disparities?
For gluten, no significant difference emerged, but generics were notably more likely to contain soy. That finding contradicts assumptions that brand names are always purer or vice versa. Each product needs individual scrutiny.
Labeling gaps compound the problem. What did the investigators discover about disclosure practices?
Many inserts list starch or lecithin without origin details, and only 17% of companies claiming gluten-free status had actually tested their products. Regulations allow ambiguity when allergens fall below certain thresholds, leaving patients uninformed.
Let's turn to health effects. For someone with celiac disease, how damaging is even a trace of gluten from a pill?
Extremely damaging. A tiny fragment activates an autoimmune attack on the small intestinal lining, leading to malabsorption, fatigue, bone loss, and neurological complications. Medication exposures accumulate just like dietary slip-ups.
And for non-celiac gluten sensitivity?
Symptoms: headaches, joint pain, rashes, brain fog, flare quickly. Because the source is unexpected, people often treat the flare with more medication, potentially repeating the cycle.
Soy allergies can be unpredictable, sometimes severe. How do soy-derived excipients fit into that risk landscape?
Soy lecithin retains allergenic proteins. Reactions range from hives to anaphylaxis, and soy also exerts estrogen-like activity, raising additional concerns. Sensitive individuals must treat unlabeled soy in medicines as seriously as soy in food.
Food allergens are tightly regulated, yet drug excipients slip through. What explains this regulatory gap?
Pharmaceutical rules emphasize active ingredient safety and efficacy. Excipients are considered inert, so full sourcing disclosure isn't mandatory. Testing requirements are minimal unless a company volunteers more transparency.
Patients need practical strategies. First, how can we reduce reliance on allergen-laden medications altogether?
Rethink why you reach for pills. Chronic headaches, joint pain, or poor sleep often stem from lifestyle factors: blood sugar swings, dehydration, lack of movement. Addressing those roots cuts the need for symptom-suppressing drugs.
When medication is unavoidable, which formulations are generally safer for gluten or soy-sensitive individuals?
Non-oral routes, rectal suppositories, inhalers, topical preparations, showed minimal allergen presence in the study. If you must use oral drugs, ask pharmacists to source verified allergen-free brands and obtain a full list of inactive ingredients.
Reading labels matters, even on medicine. What ingredient codes should listeners watch for?
Look for pre-gelatinized starch, sodium carboxymethyl starch, lecithin, and xanthan gum. If the source isn't specified, consult the manufacturer. Assume ambiguity equals risk until proven otherwise.
Beyond ingredient vigilance, lifestyle choices form the foundation. Which habits most effectively lower dependence on pharmaceuticals?
Optimize sunlight exposure for circadian rhythm. Avoid processed foods. Include sufficient healthy carbohydrates to support metabolism. Engage in daily movement and refine sleep hygiene. These shifts strengthen resilience and reduce symptom frequency.
Listeners often ask for quick clarifications. Why are medications a hidden problem when they contain the same allergens people already avoid in food?
Because the dose is unsuspected and repeated. A tablet taken twice daily introduces gluten or soy every 12 hours, sustaining immune activation. The root, swallowed, dissolved, injected, doesn't reduce allergenicity.
Which drug categories pose the highest risk according to current data?
Pain relievers and fever reducers top the list for gluten. NSAIDs, particularly liquid forms and soft capsules, lead for soy. Asthma inhalers appear lowest risk, but always verify new products.
Ingredient identification can be confusing. How should someone confirm a medication's safety before starting therapy?
Request the manufacturer's excipient specification sheet or speak with a compounding pharmacist who can formulate an allergen-free alternative. Never assume starch or lecithin is benign.
Ultimately, diligence empowers patients. What core message should listeners carry forward?
Treat medications with the same scrutiny you give food. Use drugs only when essential. Choose formulations with transparent sourcing, and build a lifestyle that minimizes the need for pharmaceutical support.
That wraps today's discussion on hidden gluten and soy in medications. I'm Ethan Foster, encouraging you to examine every label and prioritize the habits that keep pills a last resort.
And I'm Alara Sky. Thank you for joining us on Dr. Mercola's Cellular Wisdom. Stay informed, stay proactive, and we'll meet you next episode with more direct insights into health and wellness.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.